Hello, hello, good afternoon. Andrea Tarowski here with Dental Health Tutoring. Let's talk about antibiotics prior to the patient's procedure. So we're not talking about antibiotics that they might be on if they're sick or if there's an infection or something along those lines, but we're more talking specifically if the patient needs to go on antibiotics prior to their appointment. And I apologize, I've been sick, so let me just take some water for one moment. I feel a lot better, but I still have that little sort of tickle in my throat, so sorry about that. So those patients who need to go on antibiotics before their procedure. So if they're having a dental cleaning, if they're having a tooth taken out, if they're having a dental procedure, think anything where the dentist or the hygienist needs to go underneath the gum line. So if the patient is simply having x-rays done and that's it, they would not need to go on antibiotics because you're not doing something invasive. But if they do have to go on antibiotics, it's a good thing to know how much that they'll be on because they might have questions. And you also have to know when they should be taking them. Now, this depends on the textbook and it depends on who you ask. So currently, right now, you can take antibiotics at the time of their appointment. Technically, even, they can take it after their appointment as well. But the safest course of action is to take it 1 hour before. So you will have those patients that come in for their cleaning and say, oh shoot, I forgot to take my antibiotics. Years ago, we would have to send them home and say, well, I'm sorry, you have to have them in your system for at least an hour, preferably 2 hours. We can't just hang around for 1 hour. We have other patients to see. So we would have to send them home and then they would have to come back some other time. But now they can take the antibiotics at that time or even when they go home. It's preferred to take it as soon as possible, but the reason why I say at home after their appointment is because you might have those patients who tell you afterwards, oh shoot, I was supposed to take antibiotics, wasn't I? And then you're thinking, well, I just did the whole cleaning. This isn't a good thing. Oh my goodness, like something could happen. So telling them to take the antibiotics as soon as they're home is okay too. So I don't mean to confuse anybody, but this is how it is. If you're taking the exam soon, the best answer is to take it an hour before. But you can take it at that time of the appointment and you can even take it afterwards. But I made some notes here of how much they should be taking. Now, this is not for children. This is specifically for an adult. So if they're taking amoxicillin, they need to have 2 grams orally, okay, taken 1 hour before. That's it. Keep it simple. So 2 grams orally. Now, this isn't something that you would be giving them, so you don't necessarily have to know this. It's the dentist who would have to know this if they were to give them the antibiotics at the appointment. So it depends, right? But since this isn't something that you would have to do, you don't have to worry about it as much. But it's still a good thing to know if you're taking the exam because this could be a question on the exam. So next one here. So if they're allergic to penicillin, then you would not give them amoxicillin, but you would give them clindamycin. So for this one, it's 600 milligrams orally, an hour before. So everybody's okay with that. So for amoxicillin, I said 2 grams orally, but if they're allergic to penicillin, then you have to give them clindamycin, which is 600 milligrams orally an hour prior. But yeah, those are the 2 main ones. There are 2 other ones also that they could ask about on the board exam. Cephalexin, which I'm probably not saying that right, but cephalexin, you would give them the same as amoxicillin, so 2 grams orally. And then the last one is clarithromycin, which is 500 milligrams orally. So does that make sense to everybody? So If they can take penicillin, then amoxicillin is something that they should have because that just seems to work the most thoroughly. But if they're allergic to penicillin, then you have either clindamycin, cephalexin, or clarithromycin, if I'm saying those properly. So for the clindamycin, it's 600 milligrams. For the cephalexin, it's 2 grams. For the clarithromycin, it's 500 milligrams. And then for the last one, oh no, I said clindamycin already, right? Yeah. So those are the main ones that you have to know. For dental assisting students, for dental hygiene students, keep it simple. Those are the main ones that you have to know for the exam. So I hope my little explanation helped a little bit too. If you guys have questions, please make sure to comment and I would be happy to help out. I will see you guys in the next one.